Hello, and thank you for joining us. I'm Sandy Potter, along with Masonicare President and CEO, JP Venoit, Dr. Ronald Schwartz, our Senior Director for Continuum Health Services, and we're very happy to have a special guest with us this week, Andrea Matthews. She is the Director of Quality and Specialties Services for Masonicare Home Health and Hospice. Welcome, Andrea. Thanks for joining us.
Thank you for having me.
It's a pleasure to have you. During the pandemic, your team has cared for hundreds of patients in their homes who have been COVID positive. When you reflect back on this past year, what has this experience been like for you, both professionally and personally?
Well, starting with personally, I think my family and myself have fared fairly well. We had a couple of mild cases of COVID. Everybody stayed employed. Kids have done okay, grandkids have done okay with virtual school and that kind of thing. I think it's professionally that I've felt the biggest impact, as most of us have. In my position as the Director of Quality, Infection Control, Emergency Planning, Policy Management, and Education all fall under my department. So that really impacted me directly. And COVID quickly consumed all of my time, literally. In the home care arena, we have, the same concerns as in all healthcare settings, patient screenings and PPE supply management, staffing issues, all of that. But at the same time, we have that unique challenge of not being in a bricks and mortar situation. We have very little to no control over the environment of the patients that we care for and the staff, where the staff is working. We're not only caring for the patient, we're caring for the family or any visitors that are present in the home. We have no control over the environment, very little. Most people don't take a lot of our advice. They don't comply with that as much as we would like. So really, understandably, our staff was initially very anxious and very fearful, both for themselves and for their own families and what they were going to be bringing home to their families. So communication, of all the things that we were managing, I think communication became key. We worked very closely with the Connecticut Association for Healthcare at Home, with the Department of Public Health. We've worked with the CDC guidelines and CMS and all of that, which was a challenge, especially in the beginning, because things were changing hour to hour, day to day. We were trying really hard to keep the communication as clear and concise and consistent as possible to alleviate that anxiety with our staff. And I think one of the most successful decisions we made with that was that my executive director and I very early on established ourselves as the primary sources of communication. So all questions were answered by us, all communication came through us. Any education came through us, whether it was in conference calls, emails, virtual meetings. We did that on a regular basis. We quickly found that no communication could be too much. We really needed to maintain as much communication as possible, but we wanted to avoid that telephone game kind of situation where things get misinterpreted and miscommunicated. And I think that really that was one of the best decisions we made. It really provided for a very calm, consistent approach. And I think that was very efficient and very effective in calming the staff while still communicating what we needed to communicate. The challenge was really staying current with all the information. That was overwhelming. It did settle out after a while, but in the beginning it was very overwhelming. I really feel very privileged to be working with such a wonderful team, from the field staff to the supervisors, to the directors, to the executive director level. And we all work together with that goal of the health and safety of our patients and our staff in mind. It's also just really been an honor to work with the coronavirus task force. I think once we started the task force, just having the resource of such talented, leaders in all aspects of the continuum of Masonicare has been invaluable. So it's really been an honor and a privilege to get through this together. So that's really, I think, the crux of what we're finally getting there. But it's been a lot. It's certainly been a lot.
Oh, thank you, Andrea. What an incredible team effort on all your part. And JP, providing these medical services to patients in their homes was and remains so critical during a time when so many people have been in need.
Well, Sandy, I will say that Andrea and really the entire home care staff did an amazing job. Andrea talked a little bit about the changes that were happening, and when COVID first hit the state of Connecticut, there was a pretty significant focus on hospitals and, in some instances, the skilled nursing facility. But I will tell you, the home care side actually was not really focused on as in the state of Connecticut or nationally, and that posed some pretty significant challenges for us as an organization. The task force got together, talked about a lot of things, but even when we had what we thought were answers on the task force, we would leave the meeting and those answers would change due to CDC guidelines or DPH changes. But Andrea and her whole group did an amazing job. And, when you think about the home care side of our business, they were actually really the first ones dealing with COVID in so many different ways, from how to wear PPE appropriately, and as Andrea said, in an environment that wasn't controlled by us. And those posed some very significant concerns for us and issues. But we also used the home care company as somewhat of our barometer. When we started to see cases in our branches and they started to escalate, we knew that there was a really uptick in cases in that area. And knowing that those upticks may have an impact on all of our staff or those that we serve helped us in really push for where we needed to focus a little bit more of our infectious control. So Andrea and her staff, I just can't tell you how proud I am of them. They were amazing during the task force, listening to what was happening, how many cases they were having, or guess what was something new that was popping up in those areas where the task force can get together and say, hey, let's try this, or let's do this, or geez, I'm not seeing it over here, but it may happen over here, so let's get ready for it. So the home care company was truly inspirational in how it was managed, and I think we saw an uptick of cases because of how well we did in managing it. And on one of the videos we did earlier on one of our nurses in our home care company that took care of COVID patients, just hearing that passion and that caringness that she had and the support that she felt from really all the other services to help her to care for that patient was amazing. And as Andrea talked, I started to remember that dialogue we had with that nurse a few months back, and we're still in the battle of it. We're still dealing with it, but it is definitely something that I think we are better prepared for. I think we are figuring out what that normalcy is, and I personally see our home care services continue to grow. As COVID has created a new normal, I think people really want to utilize home and community-based services more than going to an institution. So as much as COVID has been a challenge for us, it's created new opportunities. And thanks to the efforts of Andrea and really all of the home care staff, we're able to capitalize on those opportunities. So Andrea, thank you for everything you do. I've thoroughly enjoyed working with you on the task force. I said earlier, there's challenges and opportunities. I will tell you, one of the opportunities that I had was the fact that I got to know Andrea better. And that has been a true treasure for me, because to be able to learn from her. So Andrea, thank you for all of that. And I look forward to continuing to work with you.
Thank you so much.
That's wonderful, JP. Thank you. Moving on to medical news, Dr. Schwartz, blood clots possibly stemming from the COVID-19 vaccine continue to be investigated by health officials. The focus has really been on the Johnson & Johnson vaccine, but is it true that some incidents have also occurred in individuals who had received the other COVID vaccines?
Well, that's true, Sandy. And every time we do these shows, there's something new about COVID. So we'll talk about this today. But I did want to share JP's sentiment about Andrea. Just, it's been great to get to work with you and all the quality work that you've done through home health and hospice. And, it's like you meet new friends as you go through this kind of crisis, but it's something that when you reflect back and you think about it, everybody that we've worked with and had on these shows, leave a special part in our heart. So I want to say that to you too.
Well,
Before now, I turn to the business at hand, which is good old COVID and the vaccine. So, probably most of you knew and were watching the news that last week Johnson & Johnson vaccine was put on a pause because there was a condition called CVT. That's the new medical word, CVT. What does that mean? Cerebral venous thrombosis. So it's like a stroke-like syndrome. And this happened to be associated with low platelet count. So they call that thrombocytopenia. So CVT with thrombocytopenia. And actually, there was a study done by Oxford University. And Oxford was working in partnership really with AstraZeneca to make the AstraZeneca vaccine. But what they studied is they studied Moderna and they studied the Pfizer vaccine. And they also found that both of these vaccines, there was a similar incidence of the CVT in the Pfizer and the Moderna vaccines as compared to AstraZeneca. And actually, just to kind of go over things again, because we've talked about this in previous shows, the Pfizer and the Moderna vaccines are what they call mRNA vaccines. So that's messenger RNA, and they use this messenger RNA to essentially have cells make the spike protein, so that if you and you make antibodies to the spike protein. So if you're actually challenged with an actual COVID virus, you'll be immune. You'll make antibodies. Whereas the AstraZeneca vaccine and the Johnson & Johnson are a little different. They call them viral vector vaccines. So what does that mean? It means that you take an inactivated type of pretty much harmless virus, like an adenovirus, that can't hurt you really, but it once again targets the spike protein. Everything targets the spike protein, and you make antibodies so that, again, if you're challenged with the actual virus, you'll have antibodies ready. So what they actually found in this study was that through the Pfizer and the Moderna vaccines, there might have been 4 cases out of 1 million that actually people actually had this CVT, which again is cerebral venous thrombosis. Whereas with AstraZeneca, it might have been 5 out of 1 million. But I think the thing to really emphasize when we go over this is that people that had COVID-19 but weren't vaccinated, so you had the COVID infection but you weren't vaccinated, they in that population, there were like 39 out of 1 million that got this CVT. So it's almost 10 times higher if you weren't vaccinated but got COVID-19 as opposed to getting the vaccine. So it still speaks to the importance of getting this vaccine. I think the other thing that's important is, so last Friday, I'll say this name because it's hard to remember, Advisory Committee on Immunization Practices. So it's abbreviated ACIP. And that's a committee that reports to the CDC and the FDA. And they looked at the Johnson & Johnson data and they felt that the pause could be lifted. And, they did put in some precautions through the EUA, that is Emergency Use Authorization Brochure for practitioners and for caregivers, just to have them aware that there is a possibility of this blood clotting disorder being present. But at this point, a general pause has been lifted for the Johnson & Johnson vaccine. So I think the final thing that I do, Andrea, if you watch these shows, is I give an inspirational quote. I'm starting to run out. This is like our 23rd show. And I could probably start repeating the quotes I did before. No one would remember them, but no, I'm being honest. I'm just going forward. So here's my inspirational quote for the week. Hopefully it will lead you to finish the week in good form. So it says, "Do not go where the path may lead. Go instead where there is no path and leave a trail." You know who said that? I'll bet you don't. Ralph Waldo Emerson said that. So why did I pick this quote? Well, we're all starting our own paths now, trying to get out of the woods of this virus and the pandemic, and trying to live better and see families again, and see our own residents seeing their families again, and so forth. And we still have to be careful, and I still believe in wearing masks and social distancing, hand washing, and avoiding large crowds and travel, and most importantly, getting immunized, because again, you have to remember there's still variant strains that are present, and still younger people and young adults and adolescents, children haven't gotten vaccinated yet. And still there's a good portion of the population that still hasn't. So Andrea, I thank you, and I thank everybody for their hard work and their dedication, and we'll just keep moving forward. And again, I wish everyone health and peace. Thank you.
I'd like to just say thank you to both of you as well. I'm also reminded I shared with JP an email that came from one of our supervisors that was basically just thanking us this week for being so careful and cautious. And I think I appreciate that from the both of you specifically in your leadership, because we're not reckless. We've been very careful and very cautious on how we've managed with the health and safety of our patients and our staff in mind. And this particular supervisor's family, her immediate family, basically all got COVID from someone that was an employee of another organization, an office, I guess, that did not follow such careful guidelines and came back from a travel situation and infected everybody, including her grandchildren. And she is vaccinated, and she did not get, she was exposed, but she did not get sick. But she was so grateful that we have so many stringent guidelines in place to protect everybody. And I think that speaks, volumes about just the way this organization has managed through this whole crisis. So I just wanted to mention that.
Wow, thank you, Andrea, so much. We always say we're Masonicare strong, and I think that's a perfect reminder of how we are all in this together. So I want to thank all of you very much for your time and your insights today, and we thank you for joining us at home. Until we see you next time, we hope you'll stay safe and stay well.